Thank you for joining us for this special edition of KGW News. I'm Galen Edlin. We are continuing our coverage of the coronavirus outbreak, and this entire half hour, we're focused on answering your questions. We keep learning a lot of new things about COVID-19 every day, so joining me tonight is Dr. Claire Wheeler, a public health specialist with PSU and OHSU. Thank you so much for being here.
Thank you.
All right, let's start with this. How much does the amount of viral load impact the severity of a COVID infection? For example, are healthcare workers with more exposure to the virus more likely to have serious symptoms?
Yeah, it's hard to find an answer to that question. This has been studied, and it has been found that the death rate among healthcare personnel who get sick with this virus is actually lower than the death rate among non-healthcare personnel. If you look at that population, the mean age is around 45, and most of the people who are healthcare professionals who are getting sick and dying are women, and that reflects the breakdown of that population of healthcare workers. So their death rate is lower per capita, and that could be in part because they were younger and possibly healthier subset of our population than the general population.
A lot of different factors to consider.
Oh, yeah. Well, so for some viruses like influenza and hepatitis, we know that the size of the inoculum will affect the symptoms. And we actually did that with influenza by infecting nurses on purpose and seeing how sick they got based on how much virus we exposed them to. We're not doing that with COVID, at least not at this point. But so far, it just doesn't look like that's the case, that a bigger inoculum necessarily, at least for the general public, to a more severe disease. It may be the case for hospitalized and patients in intensive care, however.
Now, one of our viewers has another question here. Sue Ann asks, is it possible for a mosquito to carry the coronavirus?
You know, that's a great question, because we know that mosquitoes can transmit virus. They carry and other parasites like malaria. But the COVID virus, the coronaviruses, are not transmitted through a vector. They're only transmitted from person to person or person to surface to person.
This is another question here. Can the virus move across surfaces on its own? For example, if it's on your hand, you touch your face, can it move to your nose or mouth on its own, or can it crawl across an area?
You know, bacteria can do that. They're like little animals, and they actually have little, cilia and other things that can help them crawl, and they literally can crawl around on the surface of your body. Viruses are really they're more like a little robot or a little tin can. It can't move. It doesn't have anything that would be required for it to be able to move it in any way by itself across your body or on a surface. So you can feel pretty confident that if you get it here, it's going to stay here until you wash your hands.
All right, that's very good to know. Now, this is a big topic right now. Counties in both Oregon and Washington are applying to reopen, and that means more businesses, restaurants, they're going to be open to customers. What measures should people expect to see businesses taking?
Yeah, this is a really big issue. And first of all, the measures that people should see when they go out are very well described in the Oregon State Plan for reopening the state. And they really involve things like social distancing, having people sit 6 feet apart, wearing face coverings, etc., while out in public. And businesses need to comply with those guidelines, or they probably won't be allowed to. But I think it's really important for people to understand what opening things up again means. What it means is that, let's pretend like you're in a car going downhill. All of the measures we've taken so far are put the brakes on and the cars slow down, right? As soon as we take the brakes off, and this is something that we may do multiple times, 2 or 3 years, as soon as we take those brakes off, more people are going to get sick and probably more people will die. So this needs to be something that people understand. When we raise the restrictions and they start going out, there is still a risk because we have not got a cure or a vaccine for this illness. And it is out there in the population.
So as we ease off of the brakes, what should people keep in mind as counties start to reopen?
What I would keep in mind, and what I do keep in mind, is to maintain a high standard for yourself. If you don't need to go out, don't go out. It's important to support local businesses but we've already found ways to do that through curbside pickup and takeout, etc. So I would recommend that everyone maintain the face covering standard, hand washing, avoid touching people, stop with the handshakes and the hugs, only go out to do things that you really need to go out and do. And let's just kind of easy this summer and see how this pans out when we gently take our foot off the brakes.
Dr. Claire Wheeler with OHSU and PSU, thank you so much for your expertise tonight.
My pleasure. Thank you.
Now, in line with some of that conversation, Skamania County in the Gorge is now in phase 2 of Governor Jay Inslee's reopening process. But is the county ready for an influx of visitors? Here's the answer from the mayor of Stevenson and the owner of a local brewery restaurant.
We're enthusiastic, we're optimistic, but it's guarded because, we're an island county. We've got counties on either side of us that aren't advancing into phase 2 as quickly as we are. And that's the part that worries us the most, is that this is going to come across as an invitation to come out to Skamania County and enjoy some newly open restaurants. And we're just not set up for that.
Phase 2 still says stay home and stay safe. So we're hoping that everyone will abide by that. And if they do come out, that they, respect our restrictions, and that, we can just all kind of phase it slowly as we need to. We're super excited to welcome people back to our beer garden, but clearly safety is our first priority. So we just want to make sure that, yes, our locals and our local community feel safe, that they're able to come out and utilize our businesses again.
You can send in your questions anytime, and here's the new number to text. It's 503-226-5088. Now, if we don't get to yours tonight, we'll be answering questions right here at 7 o'clock, Monday through Wednesday. And coming up, an image going around online claims the survival rate of COVID-19 is 99.9%. But is that really true? We'll share what our Verify team found out. But first, another viewer question here. Do pneumonia shots help the elderly from the respiratory effects of COVID-19? The answer, vaccines against pneumonia do not protect you against coronavirus.